Bleeding in early pregnancy can be very scary, but most of the time it's harmless. However, some causes are serious, and that is why checking with your doctor matters. Today, let's talk about why it happens, what is normal, and when to get help. Hi, I'm Dr. Tekla. If you're watching this because you are bleeding or spotting in your first trimester, take a deep breath. You are not alone. Many women experience this and still go on to have healthy pregnancies. Let's start by understanding the difference between spotting and bleeding. Spotting is usually a few drops of blood. You may notice it on toilet paper or on a panty liner. Bleeding is heavier and often enough to need a pad. No matter which one it is important to inform your doctor or midwife. Bleeding in the first trimester is actually very common. About 1 in 4 women experience it. Some causes are harmless. One of them is implantation bleeding. This happens when the embryo attaches to the lining of the uterus. As this happens, tiny blood vessels can break. The bleeding is usually light, pink or brown in color and lasts 1 to 2 days. Hormonal changes can also cause spotting. Early pregnancy hormones increases blood flow to the cervix, making it more sensitive. Because of this, spotting can happen after sex or minor irritation. Now, some causes, however, are more serious, like an ectopic pregnancy, which happens when a pregnancy develops outside the uterus, usually in the fallopian tube. In this case, pain often comes before or together with bleeding. This is a medical emergency and needs urgent care. Another serious cause is molar pregnancy, which is a rare condition where abnormal tissue grows inside the uterus instead of a normal pregnancy. This abnormal tissue can cause early bleeding and very high pregnancy hormone levels. Another cause is a subchorionic hematoma. This is a collection of blood between the pregnancy sac and the uterus. Small ones often resolve on their own. Larger ones may increase the risk of complications like a miscarriage. Infections such as sexually transmitted infections or urinary tract infections can also cause bleeding in early pregnancy. During pregnancy, the cervix is more sensitive, so inflammation from infection can easily lead to bleeding with minor irritation. Miscarriage may also present with bleeding. It often starts lightly and may progress to heavier bleeding with cramps. Most first trimester miscarriage happen because the embryo cannot develop normally. If you notice bleeding, your doctor or midwife will ask you a few important questions. They may ask about the color of the blood, whether it's brown, pink, or bright red. They want to know if there are clots, how heavy the bleeding is, and if you have other symptoms like pain, fever, dizziness, or are feeling faint. They may also ask about previous pregnancies or past surgeries. These details help them decide how serious the situation is. So, when should you call for help? You should call your doctor or midwife immediately if you have heavy bleeding that soaks multiple parts within a few hours, severe abdominal or pelvic pain, you feel dizzy or faint, you are having a fever or chills, you are experiencing contractions or fluid leaking from the vagina. Even if the bleeding is light, it's always safest to let your healthcare provider know. When you speak with your healthcare provider, don't be afraid to ask questions. You can ask if the amount of bleeding is normal, whether you should avoid sex or strenuous activity, and when to return if the bleeding continues. Bleeding in early pregnancy can feel frightening, but it does not always mean something is wrong. Many women bleed and still go on to have healthy babies. Stay calm, monitor your symptoms, and contact your healthcare provider. They are the best persons to guide you. If you have found this helpful, don't forget to like and subscribe. Until next time, stay healthy and be kind to yourself.